The zipper club is when you have heart bypass surgery. Normally, your entire breastbone is cracked and you're left with a 12-inch scar. Well, it looks a lot like a zipper, but a doctor at Lankenau Hospital says he has got a better way.
See the hardening of the artery.
If you're the kind who expects your surgeon to be standing at your side during an operation, Dr. Francis Sutter isn't your man. He's working behind this console on a patient who's across the room underneath a robot that looks like a giant bug. And Dr. Sutter wouldn't want it any other way.
The goal is to do 21st century surgery. Don't you expect 21st century surgery now?
Heart bypass surgery reroutes clogged arteries like this one being bypassed during this surgery. Robot surgery is less traumatic. There's less infection and recovery time drops dramatically from about 12 weeks to 1 or 2. Instead of one large incision and a broken breastbone, there are 3 small incisions. The doctor controls tiny instruments at the end of the robot's arms, small enough to get into areas a surgeon's hands can't.
So instead of 2 hands, we have 2 instruments, holes this big versus holes big enough for my hands to go into, with the same result. How can you beat it?
Adrienne Higgins was back on the tennis court in 3 weeks after her robot surgery. She says bad weather kept her from playing sooner.
The surgery was Monday. I was back home on Wednesday, out walking, getting some exercise, and then in fact by Saturday of that same week I was out shopping.
She proudly shows off her scar. She likes knowing doctors didn't need to stop her heart.
Does anybody really think that you can just stop your heart and it's not a big deal? It is a big deal. So if you can eliminate putting tubes in the heart and stopping the heart, things are going to be less complicated and the patients are going to do better.
Not everyone is a candidate, and right now few hospitals offer the procedure.
My goal is absolutely no more zipper club, and it's a very obtainable goal.
Now, Dr. Sutter says about 70% of his patients are candidates for the robot bypass. It all depends on your anatomy. Expect more hospitals to offer the procedure as doctors become more comfortable with robot-assisted surgery, although many heart surgeons still don't like the idea of using a robot on a beating heart. Go to NBC10.com and click on Health Watch to learn more. But it's so effective, Tracy, and the recovery time, like we said, is just minimal, and the scar hardly even there.
It is fascinating. Wow, thanks.
Welcome.